Can we give a warm welcome to Dr. Retz?
Thank you. Yeah. Thanks, guys. Come closer. Where would you like me to stand? Over here? Okay. All right, thanks. Welcome. I'm Michelle Retz with Longevity Medical Health Center, the naturopathic physician of the group. So a little bit of background on me. I'm originally from Columbus, Ohio. I'm a diehard Buckeye fan. I love Ohio State football. My mom's an RN, and my dad was a corporate CPA, and he owned a medical transcription company. So I was kind of around healthcare at a young age. I used to do payroll for my dad for pennies on the dollar. That's the payroll I was talking about. But here's a couple pictures of me and my dad together, and then the family at my brother's wedding. On the right's my dad, my brother, my mom, and then my dearest childhood friend, Brad, who I've known since I was 3 years old. Go ahead. The top left picture, I think, is my true essence. When you have a baby, I think you kind of start peeling back to, like, who are you, at the very core of your being. And I really love this picture. I think I am a happy little Buddha baby. I'm just a joyful spirit who lets it all hang out and may run around the house naked. I'm a little joker and an extrovert. My dad was really hell-bent on having a resourceful daughter who, he was a gun aficionado, and I'm vegetarian, and I don't hunt, but I have shot everything on the planet. I have a shotgun shell on my keychain. I've shot everything. I can change a tire. I can change my oil. Thanks to my dad, I'm a little resourceful gal. I've wanted to be a doc since I was 8. That's a true story. So I put this little investigative picture of me down there. I think I've wanted to look for the cause since I was very little. So I like that picture for myself. Go ahead. I was a gymnast until I was about 20, and then I got injured, and I was a cheerleader in high school just because I liked gymnastics. It really wasn't for the sports or the boys or anything. I was going to cheer for Ohio State, but I got injured, so I missed tryouts, but that's the way life works. So there's a couple pictures of me screwing around in the boys' locker room. When I was at Ohio State, I majored in biology, and I studied Spanish, so I am fluent in Spanish, so that's a market that I reach as well. Then I came out here to study naturopathic medicine. I did my residency. It was a general family practice residency, and I still teach at the school. I'm a professor of gastroenterology, which is all things gut related, and then I teach an advanced women's health course two quarters out of the year. And I have student rotations where the students follow me. They learn how to treat patients and do what we do naturopathically, and then they can shadow me at my private practice. Go ahead. One of the groups I'm really passionate about is Naturopaths Without Borders. This is akin to Doctors Without Borders. It's the naturopathic version. We go down to Mexico every month, and I take as many docs and students as I can, and we treat the underserved and the homeless with all of our natural modalities. It's really awesome. I'm a member of a lot of other groups too, and they mostly have to do with global health, so I'm really passionate about global health, which is very different than the wonderful health care we're provided here. You can go ahead. Here's my family, really important to me. So my brother is my favorite person on the planet. We are 3 years apart, but very, very close. He's my best friend. So that's him and his wife, Andrea, at the top with their German Shepherd, Gibson. He's a physicist and a crazy good guitarist. This was a picture of us in Sedona when he came here to visit me. There's my first baby, Bodhi, my Shepherd Chow. He's 10 now. And then, earlier this year in May, I had a little baby boy, Ari, and there's my husband, Clint, holding him in the hospital. He's been just a joy. Yeah, go ahead. And then here's Ari just in the last couple of months, from 3 months, 4 months, 5 months. So he's just a sweet little boy. Laughs in his sleep. He's just joyful all the time. It's just the best thing. And I tell people I'm close to that the two things I really feel like I was meant to do with this life were be a doctor and be a mom. And you don't always get to do those things together. So I feel really blessed that this piece of the puzzle has come together for me. And anything else good that comes my way is just icing on the cake. And I do mean that. Go ahead. I have a couple of whys. So one of my whys is my mom. My mom's a chronic pain patient. She was an RN. Because of her, when I was a young child, I tripped and fell into her Grey's Anatomy book and found, the body, and I thought it was fascinating, and I was really interested in medicine in general, but being with her through all of her health conditions, she's kind of the person that if the wind blows the wrong way, she would catch whatever it was that was in the wind. I've been through the traditional medical system with her and kind of had a day in the life of a patient, and it's been not all the time as positive as you might think it would be. Lots of frazzled doctors who run very late, who don't give you great eye contact or bedside manner, aren't really concerned with your quality of life, feel like you're on payroll. We're just rinsing and repeating, doing the same kind of treatment. And that's not everybody, but that was some of our experience. They weren't really concerned with her quality of life. So that has flavored the way I approach my practice and my patients to the highest degree, and I didn't even realize it was happening at the time, but who I am is very much a reason of what I experienced with her. And then my own personal why was, I wanted to be a doctor since I was a child. I planned on going to med school at Ohio State, and I wanted to be a surgeon. I wanted to be the best of the best, cardiothoracic surgeon. And my junior year, insurance companies really started dictating what doctors could and couldn't do, telling them how to practice, what they would reimburse, what they wouldn't. And docs started closing their doors. They had to see 40 or 50 patients a day. It really changed the game, and I kind of started to freak out. I've wanted to do this for so long. I really worried about graduating and hating my life and owing $250,000 as a result of it. So I just looked for alternatives, and I found naturopathic medicine. And I about fell over because I was doing half of the stuff on myself anyway, and they were not licensed in Ohio, so I hadn't heard about it. But the principles really spoke to me. Do no harm, embrace the healing power of nature, doctor as teacher, identify and treat the root cause, treat the whole person, and really aim for prevention. Go ahead. So what is naturopathic medicine, right? It's natural medicine that treats the whole person and recognizes the body's ability to heal itself, the healing power of nature. So it's a general practice field. A lot of naturopaths will specialize in one area of emphasis or a couple. We really do focus on holistic health and healing. It's a family practice, so we go from prenatal care all the way up to geriatric care. It blends the old, natural, safe therapies with new scientific methods, and really is aimed at empowering patients to retain control over their health rather than dependence on the healthcare system. Go ahead. So we really emphasize prevention and self-care and aim to find and treat the underlying cause of what's going on with the person. The natural therapies we use are safe, gentle, and effective. And we believe in the body's ability to heal itself. My job is to use the natural tools that I have at my disposal to give them to the patient, get out of the way, and let the body heal itself. It already knows how to do that. All I need to do is facilitate that process, right? And then symptoms are viewed differently. It's an expression of the body trying to heal itself, but that's not the cause. So we really try to look for the origin of disease and remove that and watch the patient heal. Go ahead. So there's 12 to 15 reasons why you are in your life and health or lack thereof. And all of those things have to be explored when you treat somebody holistically, which is why it takes a lot more time with a naturopath than with a traditional doc. And no two people with the same concern get the same treatment, which is another thing I love. I have 10 tools in my toolbox, and everybody who has depression doesn't get the same pill, doesn't get the same thing. I individually tailor the program to who you are. And the best thing about it is that you understand what's going on. When you understand why we're doing what we're doing, you're in control of your health. You know why. You know how to move forward, right? We go together. It's not you depending on me to tell you what to do, right? We're prevention specialists. So I look at risk factors, I look at your susceptibility, and we try to intervene to prevent other health concerns from coming up down the road. And I just love the little snippet: naturopathic doctor, health detective, supplement expert, nutritional counselor, lifestyle counselor, health teacher, public speaker, article writer, job lover, which is absolutely true. Go ahead. So what's the difference between me and a traditional doc? Not a lot on this slide. We've all gone to college for 4 years and med school for 4 years and passed 2 board exams. We're licensed. I refer to and work with specialists. I run CTs, MRIs, X-rays, ultrasounds, you name it. Go ahead. The difference really is in the treatment. I can prescribe medications if I have to and they have their place, but I have all of these natural tools to use before that, or in place of that, or integratively with that, right? So I do provide nutritional counseling to almost every one of my patients. I've had 4 years of training versus the 1 quarter a doc typically gets in med school. I do herbs, acupuncture, homeopathy, hydrotherapy. I'm technically trained in chiropractic, but I don't love it, and I refer to Total Lifestyle Chiropractic because they do it all day and they do it very well. IV therapeutics and environmental medicine, and the difference in the time I spend with my patients. You get an hour and a half with me for your first visit because we have to explore your entire life, right, and who you are, and 45 minutes for follow-ups rather than a 6 to 10 minute follow-up on average. Go ahead. And I just love the difference between allopathic medicine on the left and the naturopathic model on the right. So we're really moving from disease treatment to promoting your health, from generalized care to treating the individual, from symptomatic relief to holistic care of the whole person, right? From getting you out of relying on doctors and medications to taking control of your health and wellness. There's no dependence on drugs. It's really recognizing your body's ability to heal itself. Moving away from nutritional deficiencies into more of a healthy diet and lifestyle and integrated care. And one quote I found really resonant was, the Dalai Lama, when asked what surprised him most about humanity, said man. Because he sacrifices his health in order to make money. Then he sacrifices money to recuperate his health. And then he's so anxious about the future, he doesn't enjoy the present. The result being he doesn't live in the present or the future. Lives as if he's never going to die, and then dies as if he's never fully lived. Please live your life. Let prevention be your health. And then if you have any other questions, there's a wonderful sheet with all the other information on it in front of you. Thanks.